Grandfather started the pharmacy. We've continued community pharmacy sort of aspect around Chadsmore, Great Worley, sort of in the Cannock Chase area. This one is by a surgery that's got about 10 doctors, and then the dentist, optician around the corner. We used to have a very strong OTC business, but the prescription business wasn't a high.
Right, yeah, sure.
Now we try to keep a sort of balance of probably 80% business of prescriptions and 20% is OTC. We have a 100-hour contract in our Sainsbury's locally. That's probably our main competition, but I don't think it's really affected us so far. And I think we try to keep it as a local family company. We've got a good team of staff. They're motivated to take the sort of new contract on board. We had the benefit of moving premises just as the new contract was being negotiated. The girls literally came in over several lunchtimes and we designed a pharmacy that we wanted. So it was quite a team approach. Our priorities were 2 consulting rooms with sinks, computers, for patient access. We wanted a waiting area where people could sit in a non-commercial area. So we had like the fish tank introduced in the play area, and also less gondolas. So when people walk in, or wheelchairs, pushchairs, that they can actually come in. They don't feel sort of crowded, and I think it's worked really well. We've been able to have a health point machine so we can give people information. We're really keen to develop these kind of diagnostic type services. But I guess we developed the cholesterol testing service, smoking cessation service, and on the back of that we've been able to go into the weight management. It's a one-to-one counselling with this person who wants to change their lifestyle, and we don't call it diets, it is a lifestyle change. It checks their fitness levels, it checks their cholesterol and sugars. Talking to patients is just fantastic, and obviously when they lose weight they come and tell us about it. I think they're all very happy to have the services. I think it's still an issue with the cost of it. We apologise for charging, and we shouldn't be apologising for charging. But I think that's an education point of view from the public's perception. It isn't always going to be free. I think the most difficult part for any pharmacist is to let go of the dispensing process. I think it's a real sort of change in attitudes that get your dispensing team to be able to do that process, and the pharmacist comes out and talks to the patient and be able to talk about their medication, talk about when to take it, and literally sort of talk them through their blood sort of like levels of cholesterol, HDL, LDL, explain to them about the triglycerides and how to make a difference with those test results. We can go through what medication they're on, and that can lead to a medicines use review, and just the little simple messages, but you can't do that when you're in the dispensary. I think it's making sure that we're ready to go with the white paper. The feedback from that white paper is lots of new services getting out the dispensary. So we need to be able to do the chlamydia testing, the sort of like allergy testing services, the vascular sort of disease management. I think it's a fantastic opportunity that we can really make a difference to people at an early stage. So there's lots of opportunities, to get in there and do those sort of things that do actually bring in some funding streams. Reading the white paper, we're ready to go with the challenges of that white paper. What we need to see is some action now, and to be able to take it forward.